Welcome back to Morning Joy, where truth matters. I'm Keith Downey, your host, and today we are excited to be speaking with Chris Faddis, a co-founder and chief operating officer of Solidarity HealthShare. Good morning, and welcome back to the show, Chris.
Hey, thanks for having me, Keith. Great to talk to you.
Absolutely. Thank you so much for joining us. Now, we know, and we've seen it, rising costs have inflicted quite a burden on many families across the country, especially when it comes to healthcare. It's wild. Now, for those out there, Chris, who maybe never heard of a healthcare sharing ministry, could you maybe explain what Solidarity HealthShare is and how it may differ from traditional health insurance? Oh. Can you hear us, Chris?
Keith, are you there?
Yeah, can you hear?
Hello, there you are. Okay. I lost you for a minute.
No, that's okay.
So
go ahead.
So healthcare sharing, it's an alternative to insurance that allows us to share our medical costs together. And one of the beautiful things is what it does is it not only allows us to share our costs, and members are paying each other's medical bills essentially, is that we are also able to to avoid some of the ethical issues in health insurance, to avoid some of the procedures that we might be helping to pay for through other health plans and the like. And so it gives us kind of autonomy and control over making sure that we're only paying for things that are ethical, but also even more importantly is this idea of sharing one another's burdens through our healthcare costs.
Yeah, a very Catholic type of insurance, if you'll say so. And then you've shared your story on it was our second show. But for those that are just joining us now, could you maybe share the why behind starting Solidarity HealthShare?
Yeah, for me, the big thing was my first wife had colon cancer, very severe, and passed away in 2012. But during that time, as we fought for her life, we really needed help to get her treatments and procedures that were not something that insurance would pay for. And we raised a ton of money among the Christian community, especially the Catholic community, for her care, and it truly extended her life. I mean, she was going downhill real fast, and we were able to turn things around for a time and extend her life, which meant a lot. We had two young children. Our son was very young, and he was able to actually remember his mother. She lived until he was 3, and that was all the difference, right? And it just really meant a lot to us. And so having that experience of the communion of saints, the Catholic community, the Christian community coming together, supporting us was such a powerful thing. And we didn't just go out and say, oh, well, that's a great idea, let's start that. It was really, it came about over several months of discernment and prayer and the Lord putting it on our hearts. But that's really why we started Solidarity.
Wow. Yeah, I know a lot of these things that we've been talking with, at least people talking with that have developed ministries, it always starts with discernment and prayer. So it makes sense that that's how, essentially Solidarity HealthShare came about as well. So you mentioned that it's kind of helping sharing the burden as far as sharing, but what else does, what about it makes it Catholic? How does it align with our values and teachings?
Yeah, I mean, one of the big things is what we share into, right? Of course, all the things you think about. I need to go to the emergency room. I have to have a surgery. I get cancer. All those things. Those are all shareable services under our program. But also is all of the things that are inherently, and I would say holistically Catholic. If we look at the whole body, would be things like sharing into life-affirming fertility treatments for families. These are things like NAPRA technology and reproductive. I'm losing the term, but some of these really amazing ways that women can achieve pregnancy without destroying life through things like IVF. As well as mental health counseling, working with wonderful Catholic partners on the mental health counseling that we do. There's several other ways that the robust complement of maternity care that we offer, and then also really looking and working hard to work with doctors who align with our faith. And of course you can go to other doctors, but we work really hard to build that group of doctors that are available to you, who are pro-life, who are pro-family, who are on your side. Many of whom are Catholic, many of whom are Christian, but they're with you, and your children are going to be safe in their arms.
Oh. So I know we're kind of getting close to the open enrollment season. How does it all work? The process, and what should potential members know before joining something like Solidarity HealthShare, especially if they're with currently a traditional health insurance?
Yeah, I mean, a big thing that is different, definitely if you're looking at those options with open enrollment coming and sort of the end of the year is, probably over half of Americans are in the middle of that sort of switch or decision. It's really important to get on the phone with us now because you're going to have a lot of questions and we're going to have a lot of answers, but it takes some time for people to get their heads around some of the differences, right? And how it works. I mean, we're not acting as your insurance. We're not taking on the risk, but our members are saying, hey, we're going to commit to sharing your medical needs. We facilitate that process for you, but it's just to help, for people to understand how to do that. There are some limitations when it comes to pre-existing conditions and things, but we have lots of ways that we're able to help people in those scenarios. And so, important to get on the phone. There's lots of things we can help you with there. And then also looking at some of the options as far as things that we do with telehealth. Solidarity HealthShare is the only healthcare sharing ministry that shares into pharmaceutical prescriptions. And primarily generics, but that's a big deal that we're able to do that. And those are all things to look at. But, it takes a little bit of time for people, not on our side. I mean, you could plan it today, but for a lot of people, they've got a lot of questions. They've got to talk to their wife or their husband and make sure it's a good fit.
Right. I know a lot of Catholics who've been kind of looking into naturopathic doctors, as sometimes they tend to be a little bit more proactive than reactive, and obviously a lot of times traditional insurance they're never going to touch those individuals, or at least those particular doctors. What would that look like under something like health sharing?
Yeah, well, first, particularly with Solidarity HealthShare, we focus greatly on making sure that those kind of options are available. It was a big thing in the type of care my wife needed, and so we've actually made sure that our members have access to advanced and alternative therapies, naturopathic doctors. And honestly, since COVID, Keith, we've really seen a resurgence, an increase in that, and people choosing those kind of positions. Because of what they went through with COVID, not being able to get a doctor who can kind of personalize their care, right. And also because so many doctors are really owned by the hospital systems today, and so it's provided a new component of that. Solidarity fully shares into those kind of therapies and services. In fact, our chief medical officer is actually an integrative doctor who's a naturopathically trained medical doctor.
Wow.
And as some ministries have actually pulled back on doing those things, Solidarity continues to serve in that way. Well, a big thing that's come about is this idea of precision medicine or personalized medicine, and that's something that we are big fans of. We have a lot of members who take advantage of that.
That's awesome. Now, would health sharing be a good option for those with something like a chronic, high cost illness like Lyme?
Yeah, well, so here's the thing. Because of our, the limitation, one of the things about healthcare sharing is, it's not a be-all, end-all for everybody. So folks with certain chronic conditions, especially if they're already under care, would be considered pre-existing for those conditions. But many of our members who have, after becoming a member, discovered they have something like Lyme. Again, many insurances don't even pay for Lyme treatment, and Solidarity has been able to share in the Lyme treatment. We have several things we share into for Lyme, but we also have a world-class Lyme center here in Arizona. We're near our offices, so we have members who come here often. In fact, we have a member here in town now who's been here for 8 weeks for an intensive treatment for Lyme disease, and that is something that we share into.
Wow. Yeah, so we're obviously, I mentioned before, we're approaching the big enrollment season. Any advice you'd like to give our listeners that maybe are trying to look at different options, maybe something like Solidarity HealthShare?
Yeah, I mean, definitely, like I said, give us a call. We have a great team and they'll talk to you as many times as you need to talk to help you make that decision. Understand, the way it works and those things. We have lots of ways to help you with that and educate you. And also make sure you're looking at, if you're on a traditional health plan, insurance, whether it's your employer or something you bought online, make sure you're looking at what changes are coming in 2025. Oh my gosh, 2025. The government recently enforced new rules that require many plans to have, the transgender surgeries and even abortions in their plans. And so that's an important thing to take a look at. But definitely give Solidarity HealthShare a call. There's obviously other great HealthShare options. We tend to like ours. And again, we're there to help you make a good decision, not force you into something. And let's, get that conversation going, because it's a wonderful, beautiful opportunity to share with your Catholic community and to work together to make sure your family is healthy.
Yeah, no, you make a great point, because as you know, you're in Arizona. They recently passed that Proposition 139, which now it's like, well, it's enshrined. Abortion's basically enshrined in the Arizona Constitution. So will that play into the health insurance, like traditional health insurance? I'm not sure, but at least we know that there's an option out there like Solidarity HealthShare that's, it's based on Catholic values.
Yeah, absolutely. And I think it's something, it was very sad for that vote to pass, I think.
Yeah.
But I think, as far as the health plans and those kind of things, I'm not sure how much it'll affect that. I think some of the federal laws affect it more. But again, now when you're in a state like this now that has enshrined abortion as a right, it likely will affect many health plans. And that's an unfortunate thing. I think what we can do on our side as Christians, as Catholics, of course, is to promote the things we do believe in and to support pro-life, pro-family, life-affirming healthcare. And a big part of that is making sure you're going to good Catholic doctor, good Christian doctor. You're finding those people, and we can help you with that. Yep.
Awesome. Well, thank you so much for joining us this morning, Chris. Now we can get more information simply by going to solidarityhealthshare.org. We appreciate you and all that you do there, Chris. Thank you so much.
God bless, Keith.
You too. Alrighty, and that is the end of Morning Joy, where truth matters for the day. Now, of course, there's always those two paths that we like to mention towards the end here. Now, you can stay, if you're listening on the radio, especially, stay for the Mass, the Holy Mass. Please pray for us if that's the case. We'll pray for you as always. And otherwise, we are going to go transition on over to our after-show clubhouse, a wonderful way that we get to hang out with you and debrief from the show and just talk about everything that's been going on in the world. And of course, you can search for that simply by typing in Morning Joy Radio or GRN online and any of the social medias. But if this is us parting ways, God bless and make it a joyful day.
This has been Morning Joy, where truth matters, hosted by Keith Downey. Take some joy with you today. Visit grnonline.com/joy to listen again, share a segment, or answer the question of the day. That's grnonline.com/joy.